Friends, good afternoon. So I'm very happy to meet you all in this FMGE revision. So what we'll do is I'm going to go with the question and answer patterns. Okay. So anybody who's alive, please. Anybody who's live here, live and live, is please just make some noise in the group, in the chat section, so that the interaction be nice. Okay, don't worry about the level of the question, the framework of the question, or the how difficult is the question or something. It's more about the discussion from that particular topic is what is important, because I'm least bothered about where do I took the question, whether it's from the NEET or FMG. It's not going to matter, but the amount of points that we know from that particular topic, because previous year topics is always given importance than previous year questions. Yes. Hi Divya, Yari and Suvo. Yes. So with this small introduction, I'm going to start with the first topic. Psychosis is like a bread and butter for examiners. So they will ask a lot of questions on this. I'll read the question and I would recommend you to type the answer. Okay. Then we'll go and discuss about it also in detail. Okay. While on rounds in the psychiatry ward, you observe a patient standing still near his bed. Okay. On trying to move his hand, you feel a slight resistance and the patient remained in the final position for the next half hour. What feature is observed here? Anybody can tell me what is the answer for this? Initial resistance followed by taking the new posture. They're talking something about a posture in a patient. There are a good number of people who are here. So do you want to comment what is this question talking about? There are certain you have to look into the choices. Their choices are negativism, posturing, waxy flexibility, and echopraxia. And any student who has listened to the class or who have understood, who have the preparation, so the preparation will know that this is all about catatonia, and many students are answering it right. Answer is waxy flexibility. Okay, waxy flexibility. Very good, very good, very good. Excellent, excellent. Now what I'm going to do is I'm going to explain what is this catatonia and also the symptoms of catatonia, which is often asked. Okay, that's how our discussion is going to be. First is, what is mutism? Okay. First is, what is mutism? Can you tell me what is mutism? Anybody? Mutism is a person who is no verbal response. Okay. The person doesn't have any verbal response is called as mutism. Next, we have something called as stupor. Yes, as Suvo says in a Viva class, when in your Viva, your examiner tries to ask questions and you do not open your mouth, that is nothing but mutism. Stupor means what? A person is alert, awake, but still there is no motor response. That is called a stupor. That is called a stupor. Next, we have something called as echolalia. Anybody can tell me what is echolalia? I forgot what is echolalia. Suvo, can you please explain me what is echolalia? Suvo, what is echolalia? Anybody tell me what is echolalia? Echo means what? In a top of mountain cliff, we go and say, you make a sound. What happens? You hear the sound back. So please write it down. Repetition. Repetition of examiner's words. Examiners. Very good, Arifa Muhammad. Examiner's words. Repetition of examiner's words is called as echolalia. Okay. I'm telling you, friends, most repeated question in your FMG. Yes, yes. Next, we have something called as waxy flexibility. What is waxy flexibility? You should have all seen this wax statues, right? Now, in this wax statues, what happens is that when they are making the wax statues, initially when you make the wax statues, initially there will be resistance. But once you make the statue, it will maintain the posture for a long time. So the definition of waxy flexibility is initial resistance followed by taking the new posture or maintaining the new posture. It's called as waxy flexibility. Along with, there is one important word I always tell students. Is this clear? Okay, I think the PDF will be shared to you, so don't worry about taking notes and all. Okay, so we'll be concentrating on the grasping the contents. Yes, yes. What is called as catalepsy, and what is cataplexy? Catalepsy is nothing but a person is sitting here, he is having an abnormal posture against gravity, which is seen in catatonia. Whereas cataplexy is nothing but a person is awake and alert, okay, but there is a loss of tone. There is a loss of tone and the patient is going to sleep. It's called as cataplexy, which is seen in narcolepsy. Okay, sir, you're talking about catatonia. Why are you talking about this narcolepsy now, sir? Because this catalepsy, cataplexy, catatonia, narcolepsy is a bit confusing. Students might make a mistake, so I don't want you to make a mistake. So I want you to be very clear in this. I always tell my students whenever they are in my class, don't get confused. Always say lepsy will not go with lepsy. In narcolepsy, you will have cataplexy, whereas in catatonia, you will have catalepsy. Yes, yes. I want everybody who is listening to this class. So, Tejaswani is a very known name. Mohammed Irfan. Okay, everybody and Sarfaf Balki. Type lepsy will not go with lepsy. Lepsy will not go with lepsy. You should not make a mistake. Lepsy will not go with lepsy. Yes, yes. Catalepsy is seen in catatonia, whereas narcolepsy will have cataplexy. Is it clear, friends? Is it clear, friends? Yes, very good. Mohammed Irfan has already typed it. Yes, yes, yes. 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 Now, I have a very bad habit of repeating whatever I'm saying. So, please bear with me. Mutism is no verbal response. You are not at all opening your mouth. Stupor is alert and awake, but there is no motor response. Echolalia is repetition of examiner's words. Waxy flexibility is the question that we are dealing with. Initial resistance followed by a new posture. Next. Catalepsy is seen in catatonia, cataplexy is seen in narcolepsy. Yes, yes. With this, I'm going to the second question. Okay. A man who is distressed decides to consult a psychiatrist because he keeps having thoughts that his wife is having an affair for the past month. He believed that his wife was being unfaithful. Okay, he believes. Yes, that's a nice point. He reported that the images of fruit displayed on his wife's social network page signaled that she was having an affair. As a result, he began placing fruits around their house in order to demonstrate his discovery. He reported no use of illicit drugs that have no other complaints. He was able to do his job. What is the most likely diagnosis? There is no substance. He is able to go to his job. What is the most likely diagnosis? Anybody can tell me what is the answer for this? I want you to tell me why you tell the answer also. Is it personality disorder? Is it acute transient psychosis? Is this delusional disorder or schizophrenia? Answer is very good. Saraf is saying, Balki is saying, but the answer is delusional disorder. Answer is delusional disorder. Can anybody tell me why is this delusional disorder? Yes, I think everybody is answering. So I think everybody got this point. So I'll please explain. I'll please explain here. Please concentrate. Delusional disorder is a disorder where there is delusion. Wow, how life is easy for us. Yes, yes. Now this delusion is nothing but a person is having a false, fixed, firm belief. Here the person is having a false, fixed, firm belief that his wife is having an affair, which is outside one's socio-cultural background. Okay, based on his education and the social upbringing. Okay, that keeps him out. Social cultural background. Okay, now this delusions. Okay, can be seen both in delusions can be seen both in schizophrenia and delusional disorders. Now, why should this not be schizophrenia is my question. If you answer this, I'm telling you, friends, your preparation is pakka. This person is also having a delusion. Schizophrenia will also have a delusion. Why is this not schizophrenia? I want Tejaswani, Suva, Ramya Mohammed, Ryan Mohammed, everybody to answer this question. Why this is not schizophrenia? What are the points in the question which made you to think that it is delusional disorders? Just because you say that it is delusional disorder, it can't be delusional disorder. There should be some rationale behind it. Very good, very good, very good. Balki is saying that duration is more than 1 month. Yeah, that's a nice point. Actually, if you say that the person is having a belief and all that, okay, for the past month, so it's not transient psychosis. That's what he's trying to explain, I think. Yes, I can take you, Balki. That's a nice point. But why not schizophrenia? Schizophrenia can also be for more than 1 month, right? Anybody? Yeah, you're right. Okay. Anybody can explain? That's nice. Whenever you don't know, it makes me happy because I have something to explain. Yes. Delusional disorder. Prajanna Vidya. Pranjali Vidya. Very good, dear. Delusional disorder and schizophrenia. Delusion is seen in both. Yes, I accept. Hallucination is predominantly seen in schizophrenia. Functionality is normal in delusional disorder, can be affected in schizophrenia. Now tell me in the question, what are the points which says that this is delusional disorder? I think somebody has got it right. Pranjali Vidya, it's very good. I think your preparation is always is very nice. Now this is based on which I have come to the conclusion. Now can you tell me why, on what basis I have made this question, or I have come to the conclusion that it is delusional disorder? What are the points that helped you to come to the diagnosis? Excellent, Arifah Mohammed. It's nice. In your question, the person had a delusion. Yes, very good, Muhammad Irfan. But he didn't have hallucinations. Yes, functionality was normal. He was going to work. Yes, very good. That's what. Swastik Sharma, very good. Then you have understood the question. So I'll explain. False fixed firm belief outside one's socio-cultural background is called as delusion. Now this delusion is seen in schizophrenia and also delusional disorders. But what differentiates delusional disorders from schizophrenia is that delusion can be seen in both. But hallucination is seen in schizophrenia, whereas functionality is affected in schizophrenia, whereas normal in delusional disorders. Is this clear? Is this clear? Only if you understand this perspective, you can have with confidence say that this is delusional disorders. Please give a thumbs up if you're able to get this. Any person who's listening to this, please say that you are able to get this point. Give a thumbs up. Give a thumbs up if you're able to get this point. Seems to be very simple and basic, sir. These are all I know from my kindergarten class, sir. Why are you teaching me all this? But it is very basic, which is often asked. Please give a thumbs up if you're able to get this. Balki, Vaildia, Sharma, Irfan, Mohammed, Suva. Very good. Next. A boy is experiencing low mood, okay, decreased energy and decreased interest in his surroundings. He is not taking food for the past 1 week. The thought sample says that I lost my head, I am dead, how can I eat? What is the delusion seen in this case? My God, wonderful question. Let me see who is going to answer this. Nice. You are all replying. That's what makes class interesting. Yes, my monologue is always boring. I always need people to interact. Again, the answer is C. I think all the answers are C, man. My God. Very good, Mohammed. Nihilistic delusions. Nihilistic delusions. Yes. So except Ritika's tiny tummies and YH, all others are getting the answer without any confusion. I'll explain. See, in delusional disorders, there is something called as Cotard syndrome. Cotard syndrome. Cotard syndrome is nothing but nihilistic delusions. Nihilistic delusion means I'm going to die. Okay. What is the use of me exit? All the intestines are rotten. Why should I live? Okay. That is called as nihilistic delusions. Now, please concentrate. This nihilistic delusion is seen in a disorder called as depression with psychosis. And the treatment for this, as the person is having both depression and also psychosis, the treatment is antidepressant and antipsychotic. Okay, I want you to picturize this in your brain. This is mainly for you, Sarfraz Balki. I think your name is Balki. So please have this very clear. Yes. Cotard syndrome is a syndrome which is a delusional disorder, which is having nihilistic delusion, which is seen in depression with psychosis. The treatment is antidepressant with the antipsychotics. Antidepressant with the antipsychotics. Yes, friends. Now I have a question. Why are you not saying that this is Cotard syndrome? Only Balki is saying Cotard syndrome. Everybody is saying nihilistic delusions. Why? If you have understood this again, then it means that if you explain, see, getting to answer is very easy, but you should know why have I got this answer. That rationale will determine your confidence level and your preparation also. Anybody? What makes you think that this is not Cotard syndrome? Let me see. I think there is a lag always. There should be always a lag. So I think that's why you're taking some time. Otherwise, you're all brilliant fellows. See, very good, Subo. See, if they ask you what is a syndrome called as, then the answer is Cotard syndrome. If they ask you what is a delusion called as, it is nihilistic delusion. What is a psychiatric condition in which you see this? Depression with psychosis. What is the treatment for the patient? Antidepressant with antipsychotics. I'm telling you these questions, friends. I think Suvo and all is answering wonderfully. But many of the students, when this question was asked, became more hyperactive, saying that, my God, Cotard syndrome. I read in the exam, I read in my preparation. So let me go for Cotard syndrome. No. So I want everybody to type delusion means nihilism. Type delusion means nihilism. Type. This is very, 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 very important. You can't make a mistake. Cotard syndrome, nihilistic delusion, depression with psychosis, antidepressant with antipsychotic. There should be no confusion at all. Yes. Next, we have something called as, which of the following is not a good prognostic factor in schizophrenia? I have some choices. Positive symptoms, late age of onset, insidious onset of symptoms associated with the depression. Thank you, Jayakannan, Sharma, Suvo, for being more responsive. You're replying. That makes my life happy. Which of the following is not a good prognostic factor? Positive symptoms, late. See, again, this not except. These are all you should be concentrating much. Everybody is saying insidious onset of symptoms, so I'll also go with insidious onset of symptoms. Okay, because it's a bad prognostic. I'm going to explain all the good and bad prognostic factors. Please bear with me. Okay. Age. When it comes to age, what age has better prognosis? Late age. I'm always talking about better. Okay. Gender. Which gender is better? Female. Onset. acute or abrupt. Okay. Yes. Family history. If there is family history of schizophrenia, it's bad. Whereas affective illness is good. Similarly, when the person is having symptomatology, positive symptoms, negative symptoms, affective symptoms. Positive symptom is good, negative symptom is bad, affective symptom is good. Can anybody tell me what is positive, what is negative, and what is affective? What is positive, what is negative, and affective? What is positive, negative, and affective? I'll explain again. It's very, very important. Okay. Positive, negative, affective. Positive means what? When there are a group of people, in the crowd, when compared to the so-called normal people, a person with schizophrenia, when compared with them, they have something extra or more is called positive. Okay. What are positive symptoms? What is the schizophrenia patient is going to have extra? Delusions, hallucinations. What is called as negative symptoms? A, motivation, A, sociality, A, logia, A, volition. When compared to the so-called normal crowd, the schizophrenia patient will have negative, is devoid of something that is called as negative symptoms. Affective is nothing but they will, though it's a schizophrenia, they will have some mood symptoms. That is called affective symptoms. Okay. So this categorization is also important because they have asked. Positive is delusions and hallucinations. Negative is A, motivation, A, sociality, A, logia, and A, volitions. Affective is mood symptoms. Is this clear? Is this clear? Yes. I'm going to repeat. Late age of onset, female gender, acute or abrupt onset. Family history of schizophrenia is bad, whereas affective is better. Positive is good, negative is bad, affective is good. What is this positive? Delusions and what is this positive? Delusions and hallucinations. What is negative? A, motivation, A, sociality, A, logia, and aberration. What is affective is mood symptoms. Yes. Yes. Give a thumbs up if you're able to get this. Very, 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 very important question. I'm putting 5 stars here. Now we'll go to the very favorite question of examiners. Which of the following is not a part of 4 A's of Eugen Bleuler? Ambivalence, evolution, affective disturbance, autism. Let me see who's going to answer this. These are all like you should not even take a second. I'm not sure whether my students are here. I would have explained this 100 times. MA, I'm not sure whether we have met before. MA is saying autism. My God. Only Abhirami Jayakannan is saying evolution. Suvo is also saying evolution. Rohit is also saying evolution. Answer is evolution. Please have this very clear. See, please have this very clear. The contributions of Eugen Bleuler to psychiatry is he coined the term called as schizophrenia. The word that you are famously, fancily using today is nothing but the term given by Eugen Bleuler. He also given you 4 A's. What are the 4 A's? Autism, ambivalence, association loss, and apathy. Apathy is nothing. What is the autism? Autism is nothing but living in one's own world. He lives in one's own world. Ambivalence means he's stuck. He's stuck in between the two. Association loss is no connection between thoughts. And apathy is affective disturbance. Affective. There is no affect or no emotions. Affective disturbance. Yes. 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 I want everybody to type autism, ambivalence, association loss, and apathy. Please type. Thank you. Thank you. Before me telling Irfan and Subo has started typing, I think they have become, they are able to read my mind. Very good. Yes. Yes. Now I'll just add an extra point. Kurt Snyder was a person, okay, who gave something called as FRS. Anybody can help me tell me what is FRS? First rank symptoms. That is these symptoms. If it is present in schizophrenia, it means it can be schizophrenia. There are totally 11 first rank symptoms. Out of the 11 first rank symptoms, one question that was asked in a recent exam is, what is somatic passivity? See, soma means what? Soma means what? Soma means body. Yes. Yes. Passivity means what? See, like a puppet show. You have, I think you. I'm not sure whether you have seen a puppet show. Like in the puppet show, when the bodies, the doll's head, then the leg and hands are all tied to a thread, and they will move the thread, and it will sound as if the doll is moving, but actually it will be controlled by external person. Similarly, the body of the patient is externally or passively controlled by external person is called as somatic passivity, which was given by Kurt Snyder. First rank symptoms, 11 first rank symptoms. Why am I saying this? Again, they have asked this in your exam. Yes, yes, yes. I'm going to repeat again. Please bear with me. Eugen Bleuler gave the word schizophrenia, autism, ambivalence, association loss, and apathy. And Kurt Snyder gave first rank symptoms, which is totally 11. Somatic passivity, please remember. Yes. Next, I think we have finished about this topic of psychosis or schizophrenia. Okay. Okay. Yes. As within 2 hours time, they have asked me to finish all the important topics in the form of question and answer. So I thought rather than going in a haphazard way, one question from schizophrenia, one question from mood disorder, one from personality disorders, already these students are confused. I don't want to get them more confused, at least when it comes to psychiatry. I told that I will go topic wise. Anything which is categorized in memory is always better to recollect. A middle-aged female patient presents with a history of loss of interest in day-to-day activities, weight loss, insomnia, and sadness for 6 months. She recalls hearing a voice once that ordered her to kill herself. What is the DSM-5 diagnosis? Anybody? Very simple question. Very simple question. Any person who is kind-hearted like me can only frame this question. I want everybody to answer this. Let me see who is going to type this answer. Answer is yes, excellent. Major depressive disorder with the psychotic features. Yes, that's all. I think everybody is making clear. See, please have this very clear, friends. If they have all symptoms of depression, okay, all symptoms of depression for 14 days, it is depression. If they have all symptoms of depression with a psychotic symptom, here the psychotic symptom was hallucination, right? Then it is depression with the psychosis. If there's this chronic low-grade depression for more than 2 years, then it is dysthymia. It is this thing. When you have 4 or more episodes in a year, it's called rapid cycle. Rapid cycle. Yes. Is this part clear? Is this part clear? Yes. So if they give you only, if this question was in the first two line, if the last line is not there, then it would have gone for depression. But if there is a psychotic symptom, then it is depression with psychosis. Yes. If it is a low grade depression for 2 years, it is dysthymia. If it is 4 or more episodes in a year, 12 months, then it is rapid. Very simple. Very simple. Yes. Yes. A patient comes to the OPD with a history of significant mood disorder. His moods can be charted as shown in the image. What will be the best drug for him? Okay, if you want to see the image, I'm putting it like this. Oh my God, what is this, sir? This is like a, what is this? Physics class, sir. I'm not going to answer this question. What is the answer for this? Very simple. Just now I told you about this. Very simple. Ranjan Shani is saying lithium. Very good. Okay. Answer is Muhammad Shah is saying lamotrigine. Very good. Then if you have any doubts, then I think it's a good scope for discussion. Bipolar disorder. Bulky is saying valproate. Answer is sodium valproate. Why, sir? In a year, within 12 months, he's having 4 or more episodes. If you see that, you have 1 mania, 2 mania, 3 mania, 1 depression, 2 depression. Then what? 4 or more episodes is called as rapid cycling. I want you to concentrate here. It's okay if you make a mistake. You can make a mistake here, not in the exam hall. Rapid cycling means what? 4 or more episodes in a year. What are the risk factors? Female, hypothyroidism, bipolar 2, antidepressant use, are all risk factors for rapid cycling. Treatment for rapid cycling, that is what the question that they have asked for is valproate. Is this clear? Is this clear? Very, 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 very important. I wanted to concentrate here. Very, very, very important. Is this clear, friends? Yes. Yes. Already passed 2 classes from DBMCI based. Very good. Bharadwaj. Bharadwaj, have we met then? Is it? Okay, good. So 4 or more episodes in a year. Risk factors is nothing but female, hypothyroidism, bipolar 2 and antidepressant use. Treatment is what they're talking about, valproate. Which among the following is a component of Beck's triad of depression? Low mood, anhedonia, fatigability, breathlessness. Which among the following is a component of Beck's triad? Is a question. Low mood, anhedonia, fatigability, breathlessness. Please have this very clear. Please have this very clear. Major criterias for depression is 3. Low mood, pervasive, persistent low mood. Second is anhedonia. What is anhedonia? Most repeated question. Loss of interest in previous pleasurable activities. Previously, I used to take watching cricket. Now it's not giving me happiness. Previously, I used to spend time with my friends. It is not giving me a kick. Previously, I used to take classes. It used to give me happiness. Now it's not giving me a kick. So that is nothing but anhedonia. And third is nothing but fatigue. And for FMG students, I want you to concentrate. What is the key point of depression? Low mood. What is the important point of depression? Low mood. What is a very important point of depression? Again, low mood. What is a gold standard point of depression? Again, low mood. I want everybody to type key means low mood. Type key is equal to low mood. Type. Sir, why, sir? Tell me, why am I saying this? Key point of depression is low mood. If you have the habit of reading PYQs, you will know why am I saying this. Type what is key point of depression is low mood. Hi, Dr. Vidyesh. Yes, thank you. Yes, along with this, thank you so. There is something called as Beck's triad. Beck's triad was given by a person called as Aaron T. Beck. This is nothing but negative view of oneself, negative view of others, and negative view of the future. If a person has a negative view of oneself, it is called as, if I ask Jyoti Pulya, do you have any talent, Jyoti? Sir, what talent do I have, sir? I am a fit for nothing fellow, sir. I am worth for nothing, sir. Worthless. Now this Rohit is depressed. I asked the person, Rohit, why are you not talking with your friends? Why don't you share your things with your friends? Sir, what is the use of talking with that specimen, sir? Nobody can help me out of this situation, sir. Helpless. Okay. Now I am talking with Dr. Vidyesh. Vidyesh, why don't you prepare well and pass the FMGE exam? Sir, there is no chance that I can pass the FMGE exam, sir. So that is hopeless. Negative view of oneself, others, and future, which is worthless, helpless, and hopeless, is called as Beck's triad, which is seen in depression. Yes, is this clear? Is this clear? Yes, friends? Yes. So what you should know about this is low mood. Key point, important point, very important point, everything is low mood, pervasive personal low mood. Anhedonia and also fatigue. What is anhedonia? Again, they will ask an exam, loss of interest in previous pleasurable activities. Next, you will have Beck's triad. Beck's triad is nothing but negative view of oneself, negative view of others, and negative view of future, which is nothing but worthless, helpless, and hopeless. Next, we'll go to the next question. Which of the following is not a future of melancholia? Not a future. They're not talking about future of melancholia. They're talking about not melancholia is a type of depression, not a future of melancholia. Severe anhedonia, weight loss, sleep onset insomnia, profound feelings of guilt over trivial events. Let me see who's going to answer this. If you tell this, I can confidently say, please don't spend time on psychiatry. It means that you have prepared psychiatry 100%. But you should answer this correctly. I'm expecting Suvo, Tiny Voyages, Tiny Tummies and Voyages, Mohammed Irfan. Where is it? Balki missing. Balki went for a break. Huh? Everybody to answer. Jyoti, Rohit Sharma. Oh my god, Rohit is different, Sharma is different. Okay. Yes. What is that name, man? Tiny Tummies and Voyages. Nice name. What is the answer for this? Just say yes or no. If you're able to tell, it is nice. If you don't know to tell, if you're not able to remember, it's okay. We'll read now. Okay. So what is the answer is that I'll keep the answer as sleep onset insomnia as answer because it's not a feature of melancholic depression. In melancholic depression, they have intense misery. Okay. Intense guilt. Early morning awakening. Early morning worsening of symptoms. And the treatment of this is SSRIs. What is SSRIs? Selective serotonin reuptake inhibitors. Give a thumbs up if you're able to get this. Give a thumbs up if you're able to get this. Very, 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 very important. Melancholic depression is nothing but intense misery, intense guilt, early morning awakening, early morning worsening of symptoms, and the treatment of choice is SSRIs. Give a thumbs up if you're able to get this. Give a thumbs up if you're able to get this. Why nobody is replying? Hello? Anybody here? आप कहाँ जा Hey, what is happening, man? My net is all green, man. My screen is visible. Hello? Tammy's Voyages, Suvo, Irfan, Sharma, Vidyesh. Give a thumbs up if you're all here. Why nobody is replying? What is happening? You all got a blackout, absence seizures or what? Can I continue? Friends? Hey, something is seriously wrong. What is wrong, man? Okay, I think there is a lot of lag. That's why you're not communicating. Hope that is a good reason. Okay, because I thought I'll finish mood disorders now and then I'll go to the neurosis topic. So if you're all with me, it would be nice if we go to the neurosis topic. So I think with that we'll have the discussion on a lot of questions on neurosis. There will be a lot of questions on neurosis, which is very, very important in exam. Yes, can I proceed? Hey, somebody make some noise in the chat, man. Hello? Something is seriously wrong. Okay. Anyway, it's available on the YouTube, so I don't think so that it should be difficult for you. Okay. So which of the following is not classified as the OCD as per ICD-11? They're talking about something about ICD or International Classification of Disorders, OCRD. Okay. So anybody knows what is this OCRDs and all things? Anybody can tell me what is happening here? Any idea? Hello? Okay. Very good. Appa, students have started answering. Thank God. By God. Okay. Oh my God. Everybody's available. Thank you. So which of the following is not classified as a OCD as per ICD is nothing but PTSD. Answer is PTSD because it is classified under trauma and stress related disorders, trauma and stress related disorders. Okay. OCD is a very, 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 very important topic. So I want you to concentrate here. Okay. What is OCD? OCD is nothing but obsessive compulsive disorder. Okay. Where you will have a number of disorders like hoarding disorder, hair pulling disorder. Okay. Whereas PTSD is nothing but post traumatic stress disorder, which happens when a person is exposed to a trauma or a near-death experience. Near-death experience. That is called as post-traumatic stress. Good. Nice that everybody is answering this question. Yes. Which of the following is what is the minimum duration for a period to diagnose post-traumatic stress disorder in a patient? Somebody? 2 days to 1 month, more than 1 month, 3 months to 6 months, more than 6 months. Minimum duration. Very simple question. Good. Is there any minimum duration for which you can say that it is PTSD? Wonderful. Answer is, I'm very happy that you are answering it. Saundar. Radhika Saundar. 1 month. Yes. Please have this very, 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 very clear. If the symptoms are less than a month, it is acute stress reaction or disorder. If it is more than a month, okay, it is PTSD, post-traumatic stress disorder. Now, here the person will have the same symptoms. Okay, they'll have a near-death experience where they will try to avoid the situation which reminds them of that. They will have flashbacks where they will again and again have the images of what has happened. They'll be anxious, autonomic arousal. They'll be feeling dull. Okay, and they'll be feeling low mood. Okay, but based on the duration, okay, if it is less than a month, go for acute stress disorder. More than a month, go for PTSD. Sir, why are you saying this, sir? Why are you saying this, sir? I am saying this because in your exam, okay, there was a question which says that a person was robbed in a gunpoint. He was facing a near-death situation. Within 5 days of the presentation, he came to the hospital, he was admitted and all that. When asked to go back to his place, he's saying that no, he's trying to avoid going to the place where that thing happened. He's having flashbacks of the incident again and again. He's having anxiety. What is the diagnosis? This was your FMGE question. I think it is in 2020, 23 or 24. 23, if I'm not wrong. So what is the answer for that? Anyone wants to give a try? Acute stress disorder. Very good. Spastic Sharma. This, if you understand, then you have understood the concept clearly. So less than 1 month, more than 1 month. Less than 1 month is acute stress disorder, more than 1 month is PTSD. But again, the symptoms all will be same. Avoidance, flashbacks, autonomic arousal, and low. Yes. Very good, Vidyesh. A 52-year-old man is brought to the emergency department after being found in a confused state at the interstate bus station in Kerala. He is unable to recall his name, address, or any other personal information. His driving license from his wallet revealed that he is from Bangalore. I know that you have some geographical locations. Kerala is different. Bangalore is different, though both are parts of South India. And that his wife has reported that he is missing 2 days ago. She says that he got laid off from his job, after which he did not come home. What is the most likely diagnosis of this condition? They're saying that there is a trauma. Okay, he has lost his job and he has moved from Bangalore to Kerala. Somebody is saying A, somebody is saying B. Let me see what is the most of the people's response and then give my answer. Again, Aradhika is saying A. Okay. Unable to recall his name and address or any other personal information. Okay. Yeah. The answer is not A. For account information, answer is B. Okay. Okay. If there is, I'll just explain why am I saying this rationale. Dissociative disorders can be of three types: dissociative amnesia, dissociative fugue, dissociative identity disorder. In all the cases, there will be an history of trauma or a life event. Okay. Okay. Now, when I'm not able to remember my name, memory, or my father's name, my address alone, and I come to the clinic, it is amnesia. If I am having an aimless wandering, okay, after a trauma, away from work or home, it is fugue. If I am having a trauma or a life event, after that I present as a new personality or a new identity, then it is dissociative identity disorder. Aimless wandering means that's what this fellow does. He's having a life, he has lost his job, he has gone from Bangalore to Kerala. He has not told anybody, I want a break. No. He has felt run missing, aimless wandering. That is called as fugue. Is this clear? Is this clear, friends? Why everybody is crying? Is this clear? Please put a thumbs up if you're able to get this. This is what is categorization of dissociative disorder. Everything will have a life event in the clinical question, but based on the question that they explain, why they have to say about Kerala, Bangalore and all. If they have to talk only about amnesia. Is this clear? Give a thumbs up if you're able to get this. Give a thumbs up if you're able to get this. Yes. Very good. Which of the following is associated with pseudolalgia fantastica? What is this? Which is with pseudolalgia fantastica? I know the answer. Obviously, sir, you have only given the question, so you should know the answer. But let me see who's going to answer this question. Why do you see pseudolalgia fantastica? Happy baseball equipment. What is its name and all equipment? Very good. Answer is multiple personality disorder. Very good. Munchausen syndrome. Answer is, I'll explain again. Munchausen syndrome. See, Munchausen syndrome is nothing but factitious disorder. Munchausen syndrome is nothing but factitious disorder. Yes. Yes. Here the person produces a symptom. He needs a sick role. He produces symptoms to get a sick role. He produces symptoms to get a sick role. Okay. Now this person comes and gives you different types of stories about the symptoms. Okay, we call it as we have a gridiron abdomen. Okay, because you'll go for multiple surgeries and all that. So gridiron abdomen, and they give wonderful histories. Pseudolalgia fantastic. Pseudolalgia fantastic. Yes. Is this clear? Is it clear? Yes. Yes, friends. Yes, they produce the symptoms, but why do they produce it? To get a sick crow. Give a thumbs up if you're able to get this. Very simple. If you know that pseudolalgia fantastica is seen in Munchausen syndrome, it is as simple as that. Give a thumbs up. Give a thumbs up. I've deliberately chosen clinical related questions so that you'll be able to answer all this. Yes. A 45-year-old woman presents with a feeling of nervousness and abdominal pain and diarrhea. She had a history of heartburn and indigestion for the past 25 years. She gives similar complaints in the family of being tense and nervous. What other symptoms might you expect to see in this condition? A person comes with anxiety. Right? Abdominal pain, somatic symptoms and all that. Now, what are the symptoms you will see? What are the symptoms you will not see? Just ruling out, you can answer it. Common sense. You need not know psychiatry. So you don't know, you don't know what are the various neurosis disorders, eating disorders, personal disorders. But if you know some basic common sense on psychiatry, you will be able to answer this. No, this is a 2-hour session. Why you want this as a last question here? Tingling of extremities. Very good. See, basically what happens is that neologism is seen in schizophrenia. Ideas of reference is seen in psychosis, schizophrenia. Hallucinations also seen in schizophrenia. Tingling of extremities is seen in anxiety disorder. Is this clear? Very simple. I think everybody has got this, so let me not spend time in this. Okay. Now, this is a nice question. A girl was referred to the psychiatric department by a plastic surgeon. She has visited multiple plastic surgery departments requesting full facial reconstruction. She complains of dark blemishes and spots on her face which are not present. She always says that she's ugly and looks constantly in the mirror and back on the spoon on the windows. Her mother assured her of no such issue, but still, she persists in getting the surgery. What should the psychiatrist do? Should I start her on an antipsychotic, give her a surgery fitness, give her an insight-oriented psychotherapy, give her an SSRI? What is the answer for this? Tell me what is this disorder and what is the treatment? Very simple. I think everybody got this. So what is the disorder that we are going to talk about this? What is the disorder that we are dealing here? If we tell that, then the answer is that you have got it is right. SSRIs. What is the answer for this? What is the diagnosis here? No, it's not D, dear. Body dysmorphic disorder. It's nothing but body dysmorphic disorder. It's a very nice explanation. Okay, where the mirror gazing is a very classical point. Okay, look constantly in the mirror and also in the back of the spoons and the windows. Okay, so SSRIs, because it's a neurosis, so naturally SSRIs would be the main treatment of choice. A girl presented with the multiple episodes of loss of consciousness. The episodes usually happens in the presence of the family members. She regains consciousness after 15 to 30 minutes and usually remembers the events during these episodes. There is no tongue bite and also urinary incontinence. Tell me what is the diagnosis and also what is the surgery. I'm sorry, what is the treatment? Start behavioral therapy, initiate aversion therapy, give valproate, start on ketogenic diet. If you answer this, I'm telling you friends, your preparation is going in 100 kilometer speed in a very right direction. I want both tell the diagnosis and also tell me what is why you may come to the diagnosis and tell me what is the treatment. Okay, answer is right. Start behavioral therapy. But tell me why did you come? What is the diagnosis here? Everybody is giving a right answer, but tell me why. What is the diagnosis here? Very good, Shanmugam. Sri Nandini Shanmugam, you're from Tamil Nadu. Mostly. Tejaswini should be from Andhra. Start behavioral therapy. Yes. What is this? What is the disorder? Episodes of loss of consciousness. What is the diagnosis? Nobody is coming with the diagnosis. What is PNES? I only know PMS. What is this PNES? Narcolepsy. What is Radhika sound the typing? I think some previous type, now only it's coming here. What is this disorder? Suddenly there is a loss of consciousness. That's all. Non-epileptic seizures. It's a type of a conversion disorder. Yes. Now, very good. I think Radhika correctly mentioned this. Can hear what is happening. When you are having loss of consciousness, if it is a seizure or something, you will not know what is happening around the person. The person is able to have, and there is no time bite or incontinence. Yes. So there is nothing but a conversion disorder where the treatment is start behavioral therapy. And again, this is a very simple question. I'm not going to explain. What is the poor prognosis of exposure and response prevention in OCD? Again, this is an INICT question. Okay, I've just made sure that I thought that, okay, let me discuss about something called as hoarding is answer. Can you tell me what is hoarding? Yes. Very good. What is hoarding? It's very important. What is hoarding? What is hoarding? Yeah, very good, Sharma. What is hoarding? Collecting. Very good. Collecting unwanted things. So what do? You go to all the faculties and ask for PDFs and surround your room with your PDFs and the workbooks. But do you open and read it? No, sir. Will not. You waste our energy in that, sir. Okay. Do you put it for the paperman so that at least your mother will be able to buy some bucket? No. Okay. You will collect it and you will not get rid of it. That is nothing but hoarding disorder. What you're all having till you pass your NEET exam is hoarding disorder. Yes. A 40 years old male patient comes to the psychiatric OPD with the complaints of repetitive thoughts that he always feels his hands are dirty, though they are not. This gives him a discomfort and he has to wash them again and again. This is a disorder of thought dash. Again, this is a neat question. Okay. But definitely they will ask in your exam also. So it's always important to learn. So tell me, what is this? If you know this, then it means that you have understood the tell me what is the diagnosis and what is the thought dash. Radhika Saundar, tell me. Answer is C, it seems. Okay, I'll go for that, but tell me why. What is this? See, very simple. The answer is the person keeps on washing his hands again and again. It is OCD. Okay. So, thought possession. Please write it down. No confusion here afterwards. No thought possession is obsession. Thought content is delusion. No confusion here. Please type thought possession is obsession. Thought content is delusion. I know some people will say that it is content. Okay, that's why I kept this question. See, possession, Pranjali Vaidya. Content will have delusion. Does this person has a delusion? He's having a thought that his hand is dirty and keeps on washing it. Is there any word called as false, fixed, firm belief with the subjective certainty outside one's? sociocultural background. So it is nothing but, so it's not a delusion. So always see, we have thought, form, stream, possession, and content. In which form will have some 4 disorders, stream will have flight of ideas and all that. Thought possession will have obsession, thought content will have delusion. Yes, yes. This is for you, Balki, and some other fellow, Pranjali Vaidya. Thought possession is obsession, and thought content is delusion. Is this clear? Give a thumbs up. I want especially response from Balki and Pranjali Vaidya. Is this clear, dear? Balki, Sarfaraz. Okay. Pranjali. Yes. Thank you. Okay, sir. Thank you, sir. A 25-year-old man reports to the psychiatry department the fear that his penis is shrinking and retracting and will ultimately disappear into the abdomen. What is the most probable diagnosis? The penis will get shrunk and absorbed in the abdomen. What is this diagnosis? See, please have this. These are all nothing but culture bound syndromes, where Koro is nothing but fear of penis getting absorbed into the abdomen. What is that syndrome? That syndrome is nothing but fear of semen lost in urine. Okay, this is all seen in particular cultures. Okay, that's why it is called culture bound syndrome. Culture bound syndrome. I think everybody is answering this, so you know this idea. Okay, for just completion's sake, I put this question. Now we'll go to eat, sleep, sex, and personal disorders. Okay. Within how many minutes of vaginal penetration should ejaculation regularly occur to diagnose a patient with premature ejaculation? There's a new DSM-5 criteria to call a person as having premature ejaculation. If you're able to answer this question, it's well and good. It's a difficult question, I can understand. China, dear. Balki, it's seen in China. Yes. Which, then how many minutes of vaginal penetration should a person ejaculate? Okay. Less than 1. Okay. Which is called as IVLT. What is IVLT? Intra-vaginal latency time. Intravaginal latency time. A 40-year-old man comes to your clinic, reports that his sexual desire is present. Good. But is unable to achieve and maintain erection. He is not able to have erection. Okay. He has avoided physical relationship with his wife in order to avoid the embarrassment of not being able to perform. He often falls asleep early to avoid sex. What is the most common condition in this age group? Diabetes mellitus, hypertension, psychogenic atherosclerosis. 40-year-old male. Just common sense. You need not know medicine. Just common sense. Middle age. A person will have what problem? Yeah. He's having psychogenic. 21A, man. Why? Diabetes is common 40 years. Sir. Answer is psychogenic. Please concentrate, dear friends. See, this is mainly for you, Sayan Bhattacharya. I'm telling you this. Okay. See, erectile dysfunction can be of 2 types. It can be either organic or psychogenic. If it is organic erectile dysfunction, the person will have diabetes, hypertension, dyslipidemia. Because of this, there is a vascular problem and they will have erectile dysfunction. And usually it is seen after the age of 55 years or 60 years. Okay. 30s. Okay. Seem to be a recently reasonably a good age of 30 years or 40 years person presents with erectile dysfunction with no metabolic problems, then it is psychogenic erectile dysfunction. Moreover, even if you don't know this, all the three goes into organic, so the answer should be psychogenic. Yes, give a thumbs up. Give a thumbs up if you're able to get this. Give a thumbs up if you're able to get this. Give a thumbs up if you're able to get this. Yes. Which of the following most common psychiatric comorbidity would you expect in a patient with anorexia nervosa? Again, an INICT question. Let me see who's going to answer this. Anorexia nervosa will be seen most commonly with the. I'm telling you this. Okay. It's a one-liner. You need not know the mechanism and all. Anorexia nervosa and OCD is commonly associated with one very classical disorder called as depression. What is the answer? What's the answer? Depression. Very good, Mohammed. Okay. So if they ask you the same question, anorexia is commonly associated with depression. OCD is commonly associated with again depression. Is it clear? This is for you, Subo and Kartika, Radhika Soundar. Yes. A man is arrested in the police after multiple FIRs were registered against him for rubbing his genitals against women inappropriately in public transport. On questioning, the man says that he gets a sexual gratification by that way. Which of the following paraphilia describes this disorder? Very nice question. Very nice question. What is this? What is this? Exhibitionism, frotteurism, fetishism, voyeurism. Frotture, a person who rubs his genitals. A person who, voyeur means what? Sees. Okay, sees others dressing or undressing or having a sexual encounter. It's called as voyeur. Okay, what is called as fetish? Fetish nothing but non-sexual body parts like or inanimate objects are a part of sexual high. Exhibition is the most repeated question. A person undresses in public. And I'm telling you, this is a very, 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 very important question. Never step into the exam hall without knowing this. Give a thumbs up. Give a thumbs up. Give a thumbs up. Yeah, very good. Very good. Vidyesh, I think we should have met somewhere. Vidyesh, have we met? I'm not sure. New name. Give a thumbs up if you're able to get this. A mother started to feel sad and fearful over the first 2 weeks following childbirth. She felt overwhelmed by the responsibilities of nursing a baby and changing diapers and waking up in the middle of the night. She felt that she was a failure as a mother. What is the most likely diagnosis? Very good. What is the most likely diagnosis? So it's a bit, the answer is postpartum blues. Okay. Now what happens is that I always tell students if it is after 2 weeks or more than 14 days. Okay. But what they have mentioned is tearful for the first 2 weeks. Okay. So they have used a tricky word of first 2 weeks. Moreover, She's overwhelmed of the responsibilities. How many of you are overwhelmed of preparation for FMG exam? Everybody will raise your hand. Yes, yes, yes. How many are missing a good sleep? Yes, yes. You, how many of you feel that, my God, I should have, I'm a failure as a doctor of my in my MBBS times? Everybody. So do you all have depression? No, it's nothing but blues. That's what they are saying that. Yes. So I'm telling you, please have this very clear. Don't worry, don't worry. They'll not, in your exam, they'll be very clear. 4 days, 5 days, less than 2 weeks is nothing but postpartum blues. Yes. More than 14 days with the suicidal ideas and all major criterias. All major criterias of depression. Low mood, anhedonia, and depression, and fatigability. It is postpartum depression. Yes, yes, yes. A 25-year-old model who is on a top of her game comes to her liposuction done. She says that she's obese and would like to get rid of her flabby tissue. On encouraged, she revealed that she eats high-calorie food multiple times a month and regrets it afterwards. She also sometimes skips meals. BMI is 23, and this is also noted. What is this diagnosis? What is this diagnosis? Very simple. Bulimia nervosa. What is the sign called as? Russell sign. What is the sign called as? Russell sign. Self-explanatory. BMI is normal, and still the patient is eating, binge eating, and also vomiting. So naturally, it is bulimia nervosa. In this bulimia nervosa. Premature ejaculation is the disorder of which phase of sexual cycle? Okay, you will have 4 phases: desire, arousal, orgasm. Okay, we'll have it as resolution. Okay. Desire, there is a disorder called as hypoactive sexual desire disorder. Arousal, there is a disorder called as erectile dysfunction. Orgasm, there is a disorder called as premature ejaculation. And resolution, there is a disorder called as post-coital dysphoria. I want you to again give a thumbs up if you're able to get this. Every phase will have one sexual disorder. Just remember that disorder. Give a thumbs up. Give a thumbs up if you're able to get this. Yes. Yes. A 19-year-old presented to the psychiatry OPD. He has a charming personality and is well composed and behaved in front of interviewers. His mother complains of him getting into fights and bunking classes, drinking alcohol, and getting involved in police cases. What kind of personality disorder does he have? This is your more or less a neat 2024 August question. Okay, it's good that you know the answer. Anybody can tell me the answer for this? Baseball acumen, can you tell me the answer for this? Antisocial person. Because fights, substance use, police cases, legal cases is nothing but antisocial person. A 25-year-old woman complains of creepy crawling sensation on her legs. It is more common in the nights, prevents her from sleeping. She is relieved on these symptoms by either walking or moving her legs. Which of the following drug is used in the treatment of this condition? Gabapentin, pramipexole, vitamin B12, iron tablets. Drug. Anybody? Anybody wants to answer this question? Very simple. restless leg syndrome. It's because of iron deficiency anemia or hypothyroidism. Treatment is always go for gabapentin or pregabalin. If that is not in the choice alone, go for pramipexole, ropinirole. Is it clear? Yes. This is a very nice question. A first-year psychiatry resident gets a call regarding one of his patients who has been brought to the emergency room with high-grade fever and pharyngitis. The patient has been started on clozapine 2 weeks back for the treatment-resistant schizophrenia. His oral examination revealed the following picture. Okay. What is a follow appropriate management? High-grade fever with pharyngitis. So what is this? What are they talking about? This granulositis count is keeps on decreasing. Pharyngitis. So what you should do? Anybody can tell me what is the side effect of clozapine that they're talking about? Just try. You can try. Excellent, Sarfaz Balki. So they're talking about what is called as agranulocytosis. That is a dreadful side effect of clozapine. So first and foremost, what is the first thing you'll do is stop clozapine. Okay. Next, what you should do is granulocyte is decreasing. So I have to give a granulocyte colony stimulating factor. Second, this person is prone for infection. So you should start the patient on an antibiotic. So answer is 1, 3, and 5. Yes. 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 Nice question. Nice question. Well thought question. A patient with severe treatment resistant depression is planned for ECT, electroconvulsive therapy. You ask the nurse to load atropine, a muscle relaxant, and an anesthetic agent. Which of the following anesthetic agent should I load? Ketamine, methoxytol, propofol, thiopental. To be frank, I have used most of the drugs, but as per protocol, what is the drug that should be used? That is the question that they are asking. Is it ketamine? Methoxytol plus succinylcholine plus atropine. That is the treatment of choice. Why everybody is giving ketamine? Because the person is having suicidal ideas. No, that is not the answer. Methoxytol is a drug of choice for anesthesia agent for ECT. Succinylcholine is a muscle relaxant. Where is it muscle relaxant here? Yes, here. Atropine is for secretions of the mouth. Yes, give a thumbs up. Give a thumbs up if you're able to get this. Give a thumbs up. Everybody who has given A as answer, I want you to type Jaswal, Tejaswani. Tejaswani is a known name. Srinadi Sanmugam is from Tamil Nadu. Prachi should be from where in north. Suvo, I'm not sure where this person is from. Radhika Rajan. Yes. Give a thumbs up. Now we'll go to the pediatric disorders. A first standard child was referred for evaluation of suspected autism. According to his parents, he has trouble in social interactions and also has certain abnormal repetitive behaviors. He does not have any language deficits or intellectual disabilities. What is the most likely diagnosis? He's having autism symptoms, but he's speaking normally. What is the diagnosis? You should have all seen this Good Doctor series. Okay, that Sean Murphy, he'll have this problem. What is this? Very good, fun. What is the answer? This is Rett's Asperger's, not otherwise specified childhood disintegrated disorder. Asperger's syndrome. Very self-explanatory. Where verbal communication is normal, but other symptoms of autism are present. According to DSM, the following is not a type of presentation of attention deficit hyperactive disorder. Actually, again, it's a fact-based question. You can have predominantly inattentive, predominantly hyperactive, or combination presentation. Fluctuation presentation will not come. Okay, just for a fact-based point, I mentioned this. Please give a thumbs up. Fluctuation will not come. Yes. ADHD, the other name for ADHD is minimal brain dysfunction. Treatment of choices. Either you can go for methylphenidate or reboxetine. Okay. All the three things is the MCQ. So it can be predominantly inattentive or hyperactive or combined. Fluctuation will not be there. What is the other name is minimal brain dysfunction. Methylphenidate and reboxetine is the treatment of choice. Which is not a phase of sexual abuse. Engagement phase, sexual interaction phase, bargaining phase, secrecy phase. Bargaining will not come. Okay. So usually what happens is that they will have an engagement phase, okay, where a person spends time with the family member and the child. Then they'll have the sexual encounter, okay, sexual interaction, as they have mentioned here. Then they'll go to secrecy phase. They'll threaten the child not to reveal. Then somehow it will be disclosed. Okay. Then they'll go for secondary victimization, where they start blaming the child. Okay. These are the phases of sexual abuse. Bargaining will not come here. Yes. Again, these are all fact-based things. Bargaining will be coming in DABDA. What is DABDA? DABDA. What is DABDA? Anybody can tell me what is DABDA? Denial, stages of grief. Denial, anger, bargaining, depression, and acceptance. DABDA. I remember it as DABDA. It's for grief. Yes. Yes. Send a smiley if you're able to understand this. Send a smiley if you're able to get this. Pediatrics is more of fact-based questions, but it's very important because nowadays examiners wants you to know something about pediatrics also a lot. Give a thumbs up if you're able to get this, friends. Bhattacharya, Prachi. Yes. Which of the now this minimal brain dysfunction, just now I told you it's nothing but ADHD. ADHD is nothing but minimal brain dysfunction. Which of the following is not a characteristic feature of Tourette syndrome? Onset before 18 years, persistence of tics for at least 6 months, severity peaks 10 to 12 years, presence of at least one vocal tic. I always say Tourette syndrome is nothing but at least one vocal tic plus one motor tic plus 1 year duration plus less than 18 years. So answer is B, does not come. Is this clear? Is this clear? Again, my computer is stuck, or is it audible? Again, it's green everywhere in my network. Everybody type Tourette syndrome is equal to one vocal tick plus one motor tick plus 1 year duration plus less than 18 years of onset. Anything which is 4 will be definitely asked in MCQs. So it can be asked. So tell me. Type, my dear friends, type, my dear friends, type, my dear friends. Type, my dear friends, type, my dear friends, type, my dear. Yes. Yes, thank you, Vidyesh. Which of the following is an SNRI used in the treatment of ADHD? Just now I told you, answer is Roboxet. Answer is Roboxet. If a child has ADHD goes untreated, okay, ADHD untreated into adolescence, naturally what happens, he'll be very hyperactive, he'll be having impulsivity, where you'll go and fight with others, and so naturally will end up in conduct disorder. He will talk a lot, he's not going to have anxiety. Binge eating is not that much common. Answer is conduct disorder. Answer is conduct disorder. Yes, yes, yes. Just have an idea. Okay, ADHD means the person is very much hyper. Naturally, this fellow, if not going to be treated well, will go and create a lot of ruckus. So naturally, he'll have conduct disorders. A homeless man comes to an alcohol in an who's an alcoholic was brought to the casualty by the police as they had witnessed him gouging out sections of his skin. On examination, the following findings was noted. The police said that he was a drug dealer and was often experimenting with various illicit substances. What is the most likely diagnosis? What is this? $38. Gouging what sections of skin? Skin is substance. Nobody should have a doubt. Aditya Sony. Oh, Sony. See, please have this. If they say that a person is using a substance and it's causing exactly schizophrenia like symptoms of psychosis, what is the substance? It is amphetamine. If a person is having substance, okay, they're not mentioning about substance, but they're saying that this person is having Wernicke's encephalopathy. Then they are talking about alcohol. A person is using a substance and he's having cocaine bugs or tactile hallucinations. Then they are talking about cocaine. If a person is using a substance and is having a motivational syndrome, totally not motivated to do anything, a motivational syndrome, then it is cannabis. Are you able to get this? Give a photo of this and keep in your mind. Yes, yes, give a thumbs up if you're able to get this. Yes. A chronic alcoholic met with a vehicular accident. His blood alcohol is more than 300 milligram per deciliter. He needs hospitalization and will be withheld from taking alcohol. The drug that we use to manage the alcohol symptom, withdrawal symptom is. So basically they are saying what is a drug that you will give for alcohol withdrawal? Answer is lorazepam. Please have this very clear. When it comes to alcohol, you will have either detoxification or de-addiction, and then de-addiction. Detoxification is nothing but benzodiazepines. De-addiction is nothing but disulfiram, naltrexone, pomprosit. And here the benzodiazepine that they have mentioned is lorazepam. Very self-explanatory. Yes. Among patients with acute psychiatric symptoms in hospital, which of the following screening is used for the identifying the delirium? Please have this very clear. CAM method. Confusion assessment method is for delirium. Again, one liner. CAM. CAM. Most commonly used in ICUs to see whether the person is having delirium. Yes. Forensic psychiatry, which of the maximum period of voluntary self-admission under the Mental Health Care Act of 2017? Answer is, anybody can tell me what is the answer for this? Voluntarily, I can go to a doctor and ask for admission, but maximum how long can I be admitted there? $30, 7 days, 48 hours, 90 days. Tejaswani, you want to type? Yes. See, something important, forensic psychiatry, which is very important, is there is something called as nominated representative, where a person who's appointed by the family member, the patient, legal guardian, gets more weightage. According to that, a person cannot give ECT without anesthesia. And attempting suicide is no more a criminal act, because they need psychologist intervention and don't need police interrogation. Psychologist intervention. Yes. Yes. This was a question asked in a recent exam. A person with the medical termination of plan for MTP, medical termination of pregnancy, is mentally ill. So who will give consent for the MTP? Either it is the obstetrician, the husband, the patient herself, or the legal guardian. Again, an FMGE question. FMGE question. Wants to go try? What is the answer for that? What is the answer? Answer is? Answer is? Answer is what? Excellent, excellent part. Because he's a nominated representative. If identified and intervened early, rapid clinical improvement can be expected in a patient with which of the following dementias? Vascular dementia, Creutzfeldt-Jakob disease, Huntington's disease, normal pressure hydrocephalus. Answer is normal pressure hydrocephalus because it's a reversible cause for dementia. Again, asked in exam, what are all the reversible causes of dementia? Reversible cause of dementia is vitamin B1, B12, and niacin deficiency. Then hypothyroidism, then normal pressure hydrocephalus. Very important question. Yes. Which of the following future was more favor of delirium? Because gradually over a period of time, fluctuating course, preserved consciousness, commonly associated with hereditary hallucinations. Delirium. Delirium is also called as ICU psychosis. Okay. ICU psychosis, which is commonly seen in the late evenings. Okay, because it is be worsening in the late evening. So it's having a fluctuating course is the answer. Yes, answer is fluctuating course. And what is the scale I told you? CAM. Answer is CAM. Confusion assessment method. Answer is fluctuating course. Yes. Yes. A 60-year-old male who lost his wife 3 months back complains of that his intestines has become rotten. He feels that he is responsible for the wife's death. Okay. And should be sent to the prison. He complains of feeling low all the time and has lost interest in day-to-day activities since his wife's death. What is the most likely diagnosis? 3 months back, intestines rotten, lost low all the time. That is low mood. Anhedonia is there. So is it a normal grief reaction? No, definitely a normal grief reaction person doesn't say that his intestine is rotten. Okay. Schizophrenia, there is no hallucination here. Delusional disorder, the person is having depression, so you cannot say that is delusional disorder. So answer is psychotic depression. Excellent. According to Erik Erikson's first year of life, so I always say Erik Erikson gave psychosocial stages of development. There are totally 8 stages. Okay. First stage is trust versus mistrust. Okay, don't worry about other thing. That is, the child should know that yes, these are the people who are going to take care of me. Okay, the last 8 stage again they will say integrity. If my life was meaningful or not. Integrity versus despair. Integrity versus despair. Everything is MCQ. 4 words is MCQ. Erik Erikson, just write the name fully. Erik Erikson gave it psychosocial stages of development, 8 stages, trust versus mistrust. Last is integrity versus despair. What is defined as an emotional release and discharge after consciously relieving of a painful experience that has been repressed? See, my father told that I am a unwanted fellow. We better go and die when I was in 5th standard in some school. Now it is still present in my mind, locked up. I hate people, I hate people, I don't rely on people and all that. Now this repression, okay, I put it in my mind, right? That is called repression. Now when I talk about it, I talk about the emotions that is related to it and about how I felt at that time. So reliving, okay, abreaction is nothing but RE. Okay, just read this. RE is nothing but RE, emotional release, okay, by reliving of the experience, conscious reliving of experience of the repressed memories. It's nothing but abreaction. Here one RE, here one RE, here one RE. Oh my god. Here one RE. Okay, that is how I remember it. So just remember this is yes, yes, up reaction. You're interviewing a patient online on asking the patient how she has been. She replies, I'm doing gooder. I'm doing gooder. Gershkire. Her attender also informs that she uses such made up words. What disorder of thought is she exhibiting? Now, somebody was asking, what is this and all that. So, the answer is actually form of thought. They're talking about neologism. I'll explain here now. Form, stream, possession, content. Possession is obsession. Content is delusion. Stream is flight of ideas. Circumstantiality. Form is nothing but doctor. Farmer who's also a doctor who wants to buy tractor will get loan. Here we type farmer who's a doctor who wants to buy tractor will get loan. Type farmer who's a doctor who wants to buy tractor will get loan. Type farmer who's a doctor who wants to buy tractor will get loan. Farmer who's a doctor who wants to buy tractor will get loan. Derailment, that is you take a new track. Tangentiality, tangentially touch the topic. Loosening of association, there is no connection with the thoughts. And the question that they are talking about is neologism. Derailment, tangentiality. Derailment, tangentiality. Loosening of association. Farmer who's a doctor who wants to buy a tractor will get loan. Please, please, for God's sake, read this, because the first exam in which they have asked thought form disorder is FMGE exam. Not INICT or NEET, but FMGE. Thank you, Videsh. Farmer who's a doctor who wants to buy tractor will get loan. An elderly gentleman presents to you with complaints of forgetfulness. Okay, some memory problem is there. He's unable to work as his memory issues were causing him distress and he has difficulty concentrating. He has also having insomnia, depressed mood, and loss of appetite and fatigue for the past 2 weeks. He's having depression. Which of the following best describes his condition? Pseudo dementia. See, when I ask a question to you, okay, first and all, if I ask a question, what you will say? Sir, I don't know, sir. Sir, I don't know, sir. I don't know, sir. I'm fit for nothing, fellow, sir. Why are you asking me any questions, sir? I don't know, sir. I don't know answers. Seems that you don't have a brain, but actually you have a brain. But the thing is that you're depressed. That is nothing but I don't know answers seen in depression is called as pseudo dementia. Yes, very nice, because I've seen it in my clinical practice. So that's a nice topic. Again, tell me this, which of the following is a formal thought disorder? I'm not going to answer this. You are going to say thought to formal. Farmer who's a doctor who wants to buy tractor will get loan. Farmer who's a doctor who wants to buy tractor will get loan. Farmer who's a doctor who wants to buy tractor will get loan. Farmer who's a doctor who wants to buy tractor will get loan. Tell me what is the answer is. I'm waiting. Nobody is typing. Yes. Isn't it easy? Okay. That's nice. So what I'm going to do is I'm going to ask certain questions for the next 10 minutes. So let's have a quick revision. Okay. What are the, can we all type? Tell me what are the 4 A's that is seen in schizophrenia, which was given by Eugen Bleuler. Please type. Very good. MA, Autism Association, Loss, Apathy, and Ambivalence. What is somatic passivity? In which disorder do you describe it? Somatic passivity is seen in. Soma means body, passive means passively it is controlled. Where do you see that? Drug dealer is answering wonderfully. Dealer. I think he deals drugs. Very good. First rank symptoms, schizophrenia. Very good, Dr. Vidyesh. A person is having depression and also having auditory hallucination. Will you call it as severe depression or severe depression with psychosis? He's having depression. He's also having one psychotic symptom of hallucination. So what are you going to call this as? Very good, Balki. And dealer, drug dealer. Very good, Sai Lakshmi. Now I want you to tell me what is the treatment for restless leg syndrome? Restless leg syndrome. What is the treatment for restless leg syndrome? Don't tell me older, newer, and all. If I'm asking treatment, you should tell me only newer. Gabapentin and pregabalin. Yes. What is catalepsy is seen where? Catalepsy is seen where? Catalepsy is seen where? Catalepsy is seen where? Very good, very good. After a moment, catatonia. What is the treatment for melancholic depression? What is the treatment for melancholic depression? Very good, Balki. Ah, nice. Dealer. Drug dealer is answering wonderfully. Very good, MA and Irfan. SSRIs. Very good. Nihilistic delusion is seen in what syndrome? In what syndrome you'll have nihilistic delusions? Very good, Cotard syndrome. A person fears that his penis will get absorbed into the abdomen is called as what? A person who fears that his penis will get absorbed into the abdomen is called as what? Very good, Vidyesh. Koro. A person who fears that his semen is lost in urine is called as what? Very good, Vidyesh again, seen in China. Semen lost in urine. Very good, MA. That syndrome. Tell me what is a person undresses himself in a public is called as. A person undressing oneself in a public is called as what? Very good, very good, very good dealer. Exhibitionism. A person rubs his genitals is called as what? A person rubbing his genitals is called as what? Very good. Sanjeev Kumar, torture. The last question. What is the four thought to form disorders? I want everybody to take. Thought to form disorders. What are the four thought to form disorders? I have given a mnemonic also. Farmer who's a doctor who wants to buy tractor will get loan. So please try. I think dealer is typing. Yes. Why? YouTube got stuck. Yes, very good. Happy baseball equipment. Derailment, neologism, tangentiality. Thought to form disorders. Derailment, tangentiality, loosening of association, and neologism. Yes, yes. So I think it was a reasonably nice session. Okay, I made sure that all the topics has been included. Okay, and I though these questions were not mainly PYQs because I think PYQs you'd have finished by this time, but these were all something related to the PYQs, but very much relevant to the topic of psychiatry for FMG exams. So thank you for being very patient. To be frank, it was not like a YouTube session. Usually YouTube sessions or online sessions will be like dragging, but it was more like an interaction. You were all interacting, so it was nice. So please continue and keep up this good work and do this till you give your exam. And I think the way you are answering and spontaneously, I think your preparation is paka. So please continue the good work. Thank you, thank you, thank you, thank you. Wonderful. Thank you, friends. All the best, all the best, all the best.